Thank you so much, Mr. Chairman and colleagues. I also want to thank you for letting me go first, Mr. Chairman. I'm here today to present SB 165. SB 165 is another step in our effort to develop a mechanism that will ensure that limited English proficient, or LEPs, of Medi-Cal enrollees have qualified in-person language interpreter services when they visit their medical provider. I took over this issue from former Speaker Perez, Emeritus Perez, when I became Speaker in the Assembly in 2015-16. The original proposal established a framework for a qualified workforce that would be available whenever an interpreter was needed in a medical setting. After 3 unsuccessful attempts, including 2 vetoes, we tried a new approach. In 2016 budget, the Brown administration agreed to a $3 million augmentation for the support of activities related to a medical interpreter pilot project, study, or both. The accompanying bill, AB 635 at that time of 2016, has since been interpreted by the Department of Healthcare Services, maybe we need interpreters there, oh, I didn't say that on the record, to mean that the study must be undertaken and completed prior to the implementation of any pilot projects. After much delay, a vendor was selected, a contract signed, and the study finally began in January of this year. As the author, I'm here to tell you, and I had multiple conversations with most of you over the years, that was not consistent with our intent. The purpose of SB 165 is to clarify our view of that agreement. Mr. Chairman, colleagues, I know that based on your own professional experiences or from your experience in the legislature, all of you are aware of the demographics of our Medi-Cal population and the language diversity that is California. So just a few facts. According to DHCS Research and Analytical Studies Division, the report roughly says that 38% of all Medi-Cal eligible enrollees report a language other than English as their primary spoken language. Spanish, Vietnamese, Cantonese, Mandarin, Armenian, most frequently reported languages among Medi-Cal's non-English speakers. When the number of Medi-Cal enrollees whose primary language is other than English in a geographic region reaches a certain number or percentage known as a threshold, the Medi-Cal managed care plans are required to translate important written documents. In addition, there's a general requirement that all LEP enrollees be provided oral interpretation services. However, the actual delivery of interpretation services is not systematically provided or monitored. It is generally left up to each provider, and we believe that this has resulted in the use of unqualified interpreters, which could include family members, in some cases, kids or friends, and that has an impact on the ability to adhere to medical directions of medical professionals to get the quality of care that you need. So the clarification in this bill will ensure that no further time is wasted and that DHCS can begin establishing pilot projects with the ultimate goal of developing a system to ensure qualified interpreters. So I would yet again ask for your support as we continue to try to get this program pilots running, up and running in the state of California. I have 2 people to testify. They will follow the time limit. And certainly I'm thrilled to have both of them here Mr. Chairman. Marcus Castrojón, who is a policy advocate with the California Pan-Ethnic Health Network, and of course Brian Allison, the political and legislative director of AFSCME, is here to testify.